Hello everybody, I'm Dr. Raghavendra Ramanujulu, Lead Consultant, Department of Pain and Palliation Rehabilitation Services, Aster CMI Hospital, Bangalore. The topic which we are going to discuss about the relevance of prolotherapy versus platelet-rich plasma or PRP. In my earlier video, I have mentioned specifically about prolotherapy as well as platelet-rich plasma or PRP. I've mentioned the mechanism, what it acts, how it acts, and is part of the regenerative therapies for chronic pain. Now over here, what is the advantage of prolotherapy? Prolotherapy is not going to cause much of concerns unless a patient is actually on any blood thinners or pregnant or in terms of wherein patient has got severe injuries which is for surgery. Now, if the ligament concerns or tears are there which needs tightening or laxity in ligaments or tendons is much going to be handled better with prolotherapy. It's just the injection of dextrose or hypertonic saline as I mentioned earlier. Now, whereas the cost concerns are lesser in prolotherapy because these are very cheap. Comparatively, the platelet-rich plasma can be actually injected many number of times. It is something which is targeted even into the joint also. But unlike prolotherapy, it's got lesser evidence when you're looking into joint injections. Now, PRP has got a much better healing in comparison to prolotherapy, evidence says. The disadvantage, what it is PRP could be a little bit more expensive compared to prolotherapy. That is one of the issues. But more or less, both of them have got a part of regeneration of the tissue itself, as well as the mechanism of injecting where it is differs a little bit. You will have to wait a little bit for prolotherapy in terms of it action to set in. Over 3 or 4 sittings is required, whereas PRP could start within 1 or 2 sittings itself. Over a period of 10-15 days, you can repeat these injections and making it better. The most important of all the crux is the right kind of diagnosis. The diagnosis is something which we are very particular at Aster CMI. We have got an interdisciplinary team here with an ultrasound which we could incapacitate us to look into MSK ultrasound or musculoskeletal ultrasound with how to exercise, how to get rehabilitated. Physiotherapy, occupational therapy and others are all present at the same place, in the same department what we're talking about. So please visit Aster CMI to get the right kind of diagnosis and the right kind of management plan, maybe prolotherapy or maybe PRP. Please visit Aster CMI at your convenience to get your diagnosis and treatment individualized. Thank you all.